Hey everybody, I am Lissy. I am Chit Chat Coordinator from Family Strengths Network, and this is our speaker series on our upcoming childbirth classes. And we have Gretchen, and I'm sorry, I don't know how to say your last name. Is it Polson? Here to tell us about her programs. So I'm just going to kick it right on over to Gretchen.
Great.
So take it away.
Thank you, Lissy. I am going to apologize in advance because my screen is a very different one than where my voice is coming from. I'm not sure if that's going to create a problem with the recording. Actually, now that I'm thinking about that, that might be problematic.
There's a teeny tiny lag, but I don't think it's the end of the world. You can have fun with it and pretend you're dubbed from Japanese or something.
I'm speaking another language. Do you mind if I take 1 minute to try to fix this and then?
No, absolutely.
Now that I'm thinking about it, I think it might change it to a different screen.
For that, see what happens.
All right. You're good to go now.
When I have recorded things in the past, somebody starts talking and then you see their screen and you would see my phone, which might not go as well. Though it takes a lot of stress and pressure off of me. So I am Gretchen Polson. I'm going to show you really quick because I always love knowing the people who are behind any sort of speaking engagement, whatever. And I think it humanizes them just a little bit. So I'm going to share my screen and I'm going to show you a cute picture of my family. And if you have an issue seeing this, let me know. But this is my cute little family. This is my husband, Dan, and my 4 little girls. This is coming from one of my classes. So my oldest is 7 and she got dressed for family pictures and decided to put like an entire outfit under her dress, which is a lot of fun, but she has like a pink collar underneath her unicorn dress. My second child is 5. She's in the floral little cover. My third child is actually 3. She's in jeans and blue, and then our baby is just turned 1 right after the new year. So these are the cute little people who have gotten me into this whole theme. And I get to share a little bit about that and about them, and I'm very excited about being here today. So I have my 4 little girls. 3 of them were born up here at Los Alamos Medical Center, and one of them was born down in Presbyterian in Espanola, January of 2021. So she just turned 1 right around the new year. Having a baby in the middle of a pandemic while homeschooling my oldest, who is in kindergarten, was quite an adventure. The baby was planned before 2020 hit. And then once we realized the magnitude of what we were entering into, we were already pretty committed to a 4th child. And so it was a very overwhelming year. And I really felt last summer that I needed a change beyond just the stay-at-home mom life, where I got excited and proud about my accomplishments with doing laundry and really hoping that my girls could keep the living room clean. And so I looked into some things, had some ideas, and I reached out to Kelly Bear, who was the previous childbirth educator and lactation consultant in town. And she had just moved down to Las Cruces. And I chatted with Karen Brown, who is one of our town's doulas and one of my good friends. And I respect these ladies a huge amount. And they let me know about our community's need for a childbirth educator. And it kind of got me thinking, maybe, possibly, is this something that I would be interested in? So a little bit more about me. I graduated in 2011 with a bachelor's degree in public health. I love health. I love science. I love the way things work and understanding how everything works together. from graduation, I moved on to working at a hospital doing patient advocacy. And that was a really neat aspect of public health as well, where I could help people get the care that they needed and could interact with people on a more personal basis than I would have maybe in other realms. In 2013, my husband and I got married, and we moved out here in 2014, and that's when my oldest was born, was the end of 2014. And so I became a mom and loved so much, still love so much of that, depending on the day. Today has been a doozy where I had to deal with 2 kids poop in a 5-minute time period. So some days we love more than others with motherhood. It's great. But I was amazed by what my body could do, and this little person that it created with my first child. And when they put her on my chest right after she was born, it was just this feeling of complete awe that we made this little person, and then to watch her grow and to teach her all the new things has been so much fun. And then again with my second and my third and my fourth children, as they were put on my chest, just that amazing feeling of accomplishment that comes from it. And the connection and the passion that we all have when it comes to our children and it comes to pregnancy and delivery. I just really found a love for it. So I have loved teaching my kids about their bodies and then learning about my body, and especially with each pregnancy, having a better understanding of what my body can do and giving it the grace that it needs as it goes through all these changes. And even now, a year postpartum, it's still going through lots of changes, which is exciting in its own way. So when I heard that there was this hole in our town that has already missed out on a lot of different women's care services in the last couple of years, I really wanted to step up and be able to help with that. Especially between my education and my passion for this, I just figured this would be the right choice for me. So I signed up to become a Lamaze certified childbirth educator, and very quickly became immersed in the material. And I remembered how much I loved learning, and I felt like I finally was given permission to delve into some of these topics that totally fascinate me. And my husband is a little bit less passionate about childbirth than I am, but has been a great support as I run down to him and go, "Guess what I just learned?" And he is very patient and goes, "What did you just learn?" and I share with him, and I guess I kind of understand now the reversed rules when he does this, when he learns something new about muons or electrons and gets all super excited. So we all have our own things that get us all amped up and ready to go. In December, I finally became officially certified, taught my first course through the holidays, which was exciting. And then there are a few more that are coming up, which we'll talk about at the end. So thinking back, my fascination with birth actually comes from a really young age. I come from a family of 6 kids, 6 girls actually. When it was somebody's birthday, my mom would make sure to tell the story of the day that they were born. And even now, she will call us and she will tell us the story of our birth. And for me, it just never gets old. 33 years later, I know that I was induced, that my mom practically delivered me herself. She's always shared how excited she was when I was born because she was very relieved to be done being pregnant. She had 3 pregnancies very close together. 33 years later, she still remembers all the emotions, what was said to her in the delivery room, and lots of other small details that on any other given day, she probably would have forgotten. So before I move too much further into my chat, I just want to make a real quick side note, and I want to express my support for families of all types. I come from a heteronormative background, so throughout this talk, lecture, chat, Zoom call, I will probably refer to a pregnant person as a mom a number of times, but I understand that not all people who give birth are women. I support them. I'm still working on changing my vocabulary to be all inclusive. Going along with this, in my mind, support people can be husbands or wives or partners, parents, grandparents, best friends, whoever is going to make the person giving birth feel safe and feel comfortable. If I slip a dad in there, it's not due to a lack of enthusiasm for other type of support people. It's due to my experience personally with my husband being a dad. And also as I am attempting to expand my vernacular from my growing up years. So we're just throwing that out there so everybody feels loved and included. For those of you who have kids, I want you to think back on their deliveries for just a second. How much do you remember about the day your baby or babies were born? Chances are you probably remember a great deal. Some details might be a little fuzzier than others, but those memories and feelings you have from that day will probably be some of the most vivid you will have for the rest of your life. And I think that's really cool and amazing. I cannot for the life of me remember exactly how much each one of my children weighed or the time that they were born. But I do remember very specifically different nurses that I've interacted with, things that were said to me in the delivery room or postpartum room, the general feeling of how my labors went, the order that they went in. So I think you probably have similar experiences as well. There are very few days that will have the same amount of impact on your life as ones where you or your partner gave birth. A lot of feelings that will stay with you are due to the satisfaction that you feel from the delivery. And it's interesting that studies show the satisfaction felt from that day aren't actually connected to the pain level that was experienced, but it's more about how we feel we were treated and the care we received during labor and delivery. You would think that pain would play a bigger role, and it does, but it's the care and the respect that we received that day. So I'd like to tell two stories to kind of demonstrate this. I have been induced with all 4 of my deliveries because I have high blood pressure and have had a slew of other complications that just make it the best option for me. With one of my deliveries, and I will remain relatively ambiguous about which one it was, I felt like what I was asking for, a preference of how I wanted to push my baby out, was not being respected. I went into that delivery I had one thing on my birth plan, and that was a preference on how I wanted to push, and it was just not being listened to. It wasn't being respected. No matter what I was trying to do, as I was trying to fight pushing a child out the way I didn't want to, I didn't feel like I was heard, and it was really hard. And my husband also stepped in, knowing this was important for me, tried to advocate for me, and neither one of us were really listened to or heard through that time. In the end, it turned out that there was a lack of really good communication, leaving us floundering and feeling like we were observers in the care that we were receiving, which is hard when it's your own care. It's taken me a lot of years to process this experience and come to terms with everything that happened, but there were some really good things that came from it. Our daughter is healthy, which, considering she was purple and not breathing when she was born, is a miracle. And my husband and I learned that prioritizing good communication with our doctors from the very beginning is vitally important to us. And this has been a really huge asset for subsequent deliveries that we've had. So in comparison to that, with our last daughter, we started the induction with chatting with our midwife. We told her of our past experiences, what we wished for the birth, which was longer than just one thing of I don't want to push on my back. And we asked for as much communication as we could have. She's very respectful of that and very accommodating. There's a lot that did not go well with that delivery. This time it was complications with me. Actually, there was so many complications, and I was kind of out of it for a good chunk of the important part due to these complications. But I have much better memories of that delivery because the midwife worked well with my husband, and they both worked really well with the nursing team. And we felt like we were all working together for the same common goal. And that really helped to give those feelings of, okay, so that didn't go as planned, but I felt like I was respected. I was listened to. I didn't push on my back, which was one of my big things again. And we came away with a child who was healthy. I was healthy and happy, and it all worked out really well for us. So how we're treated matters, and it changes our whole experience, so that it also changes our interactions in the future, which could be both for the better or for the worse. One of the major components to all of my birth stories, and especially these two, is my husband. I feel that so often partners to the pregnant person get overlooked just because they're not pregnant. But I have a really strong opinion that they are essential to everything. They are the safe person, they're the advocate, they're the consistent supporter. They're the ones who have been with you through the last 9 months, plus whatever time it took to make the baby. They hear all concerns, all the hopes for how delivery will go, and they've probably been dreaming with you about the moment that you will both meet your baby. Society focuses so heavily on the person giving birth, and they're obviously very important, but the partners who are there through it all need some recognition and education as well. So this has to do with childbirth education. We focus on all of this. We focus on memories, we focus on advocating for yourself. We focus on so many different things because I feel like it is vitally important to give you that satisfaction at the end of your delivery that you would really like to have. The goal of childbirth classes are to prepare both you and your partner for the adventure that is coming your way. Partners are included as much as they would like to be. I highly encourage that everybody who is going to be part of the birth experience at least attends a childbirth class together, or at least as part of some of these discussions, or is let in on this, because then it makes sure that everybody is on the same page. We have 2 classes coming up with 2 different approaches of how we talk about this, and I'm very excited about these classes. They've been in the works for a little bit now. It's amazing how long it takes to put all of this together, things I didn't know before. So we have a class coming up on February 16th, which is associated with Los Alamos Medical Center. It's open to whoever would like to come. They're free classes, which is great. It's a 6-week long course geared towards first-time parents, or parent. If you have a partner that has already had children, we want to make sure that everybody has the education that they need going into this. I feel like to understand what we are feeling, we need to understand why it's happening. So we go into a lot of detail about this. I think it's super fun. That might just be me, and everybody is there to humor me and to learn from me. So I'm hoping that you think it's at least enjoyable as well. Some of the things that we talk about in this long class we're going to talk about pregnancy, even though there are pregnant people in the class. We're going to talk about pregnancy, all the development that takes place during that time, nutrition in pregnancy, exercises and stretches to help you prepare for delivery, because especially in that last trimester, those can be very helpful. We talk about relaxation, the role it plays in delivery. We talk about birth plans and how to advocate for the birth that you would like. This goes back to feeling satisfied with the birth that you have. We'll talk about stages of labor, the different suggestions that you'll hear to try to start labor naturally, why they may work or may not work, also some pros and cons of that. Like we talk about all the things from having sex to induce labor, all the way to you should eat eggplant parmesan because some recipe said that it will induce labor. So all the things are covered. The role of hormones in labor and why they are important. We'll talk about pain management, both the natural type of pain management and coping with pain, your coping techniques, and the medicinal ones, whether it's an epidural or some sort of narcotic. We talk about common interventions, inductions, what a C-section looks like, because that helps take some of the fear away from the unknown. How to advocate yourself while working with your hospital staff, which I feel very passionately about, because they are your teammates and they really only want what's best for you and your baby most of the time. If they don't, then how to deal with that as well. Recovery, what to expect while you're in the hospital, skin to skin, and why it's important both for mom and for a partner. I'm a big believer that mom shouldn't be the only one who has skin to skin with a baby, and it actually does help with partners as well. We talk about newborn care, breastfeeding, pumping, bottle feeding, however you feel like you would like to feed your child, full support. And then we have a whole class about community resources that are available to new parents. We have people come in. In our last class, we had a pelvic floor therapist. We had doula come in. We had somebody who encapsulates placentas in case that's something you're interested in. We had Carrie from FSN. We had Dr. Crone, who came and joined us, who's a pediatrician in the community. We had Firstborn, who typically makes an appearance because they're a great asset too. So we have lots of things that can really set us up and set you up as either new parents, second-time parents, third-time parents, for knowing the resources that are around you. Each class has some homework. We talked about homework, which nobody's going to see but you and your partner. There are more talking points or exercises to do together to help you prepare for baby's arrival. These can create more of a bond between partners as you work towards a common goal or talk about different preferences, things that you might not have talked about otherwise. Again, this all sounds really great and helpful for the person who gives birth, but why would a partner take this class? I believe because as a support person, you need to know why things are happening too. Why is the labor pain only in her back? Why is it best to wait until the due date to give birth, somewhere around due date? Because she seems so uncomfortable and the doctor said we could induce at 39 weeks. We talk about it. Why is it she's shaking so much after baby comes out? We talk about it. Why is it that she's saying, I can't do this, when obviously we are very committed to having this baby right here and right now? We talk about it. So I feel like at some point, the person giving birth is going to turn to their support person and look for answers and understanding and support. And this is a really great place to find it. All those answers, most of those answers, if you have more questions, you're always welcome to ask. I do want to say that sometimes concerns come up in particular about different participants' case. And I will happily give all information to you about what your provider has talked about. I will not give medical advice, and I'm always a big fan of pointing you back to your care provider because they're the ones who's going to be working through this with you. And so I will give all sorts of information to help you make the best decision possible for you. But when it comes to talking about that with your provider, I'm a big advocate and supporter of you need to talk about that with your doctor, because they're the ones who knows your case so much better than I am just your friendly neighborhood childbirth educator. I'm not the doctor in this scenario. So as of right now, the classes through the hospital are virtual. It's really hard to have a personal interaction with this, but we do the best we can. I try to stay entertaining. I pull out all sorts of props so that you can visualize what's happening and see what I'm talking about. The perks of virtual classes are you don't have to leave your house. We all know this. You can wear sweatpants. And there are some things that I'm going to ask you to do, like stretches and exercises, for example, that you can turn off your camera. You don't have to worry about anybody seeing you. And when we do relaxation, I actually encourage you to go lay down in your bed because that's a great place to practice relaxation. You might get a great nap. You wouldn't necessarily have that in a classroom setting. Some of the downsides of this is it's really hard. It's harder to engage. We know, I mean, all of these things we know from having things be virtual for the last while. Pros and cons, right? Sometimes it's difficult to understand what I'm talking about or trying to demonstrate. You might get some really terrible angles of me. That's probably more my concern than it is anybody else's. But there's also a lack of community that's created when you're in a classroom with other people versus a Zoom classroom where you just see their little face on the screen. So I'm hoping that later on this year we can move to in-person, but we'll just have to see what different numbers are like. And different classes, I think we'll just play them year by year, session to session. We'll just play by ear of how it's going to go. So while I was creating this curriculum, because I was the one, Lamaze gives a lot of open-ended structure when it comes to their teachers. They educate their teachers and then trust that. We will teach evidence-based practices in our classes, which I love, and why I chose Lamaze was for this reason. So I was able to create this curriculum, and I wanted to create a safe space for all backgrounds and allow all birth plans. So if you plan on giving birth at home with your partner there and a midwife, maybe in a tub in the middle of your living room, I think you should come. You'll get information on natural delivery without medical intervention. If you want to give birth at the hospital but have a natural delivery, I think you should come. If you are attracted to something like the Bradley method, which has been around for forever, or hypnobabies, or if you have no idea what I'm talking about, that's also fine. I think you should come. This course just gives information, and it isn't going to tell you what's right around for you. What if you want to go to the hospital as soon as they will let you be admitted to the hospital, and you're going to immediately ask for an epidural, then I still think you should come. We have information on when most hospitals will admit you. We'll talk about the process of giving an epidural. And I really think it's a good idea, even if you're planning on having an epidural from the moment your water breaks, which is not normally the very beginning of labor for most people, that it's good to have some coping techniques in your back pocket, just because you never know how long it's going to take for an anesthesiologist to show up, especially if you're delivering up here in Los Alamos, where the anesthesiologist could be in surgery with somebody else. Your labor could go super fast and you just don't know that. Or maybe your epidural falls out twice. You end up giving birth naturally, very unexpectedly. That might have happened once. But I am all team epidural, and I think it's a great place to be. Like I said, everybody is welcome in these classes. One of the really fun things about this course is that we have guest speakers to come from the community. We talked about that. We have thoughts from professionals and people who have been there before. So I pulled my husband as I was creating this, and had him put into his 2 cents, which was fantastic because I've never been a support person to somebody giving birth before. But he has, and he gives a couple tips here and there. I've also included some thoughts from a labor and delivery nurse. I've chatted with the Los Alamos Medical Center hospital or labor and delivery nurses to make sure that everything we talk about is up to date, at least for Los Alamos' policies. And I've also been able to sit down and have a chat with Dr. Pareda and get her thoughts so that we can include that as well. Things like, what's her preference when it comes to eating during labor? Or how does she prefer people to push? So all these things, since this is associated with Los Alamos Medical Center, everything that has to do with that, I've tried to include within this course. If you're giving birth in someplace like St. Vincent, you might not have as much of the same guidance, but I have a feeling it will be similar, or I encourage you to go talk to your doctor and find out what that's about. So that's the super long 6-week course for new parents. If you are a second time, third time, fourth time, whatever parent, you have other children that are at home and you want to just come for a refresher class, we would love to have you come for those specific weeks. You're more than welcome to come for the hospital for just those couple of weeks. That's totally fine. And it has some overlap with the 6-week course, but this one's a little bit different. This is going to be only 3 weeks for families who already have at least one
Gretchen,
child.
Sorry to interrupt you. Can you go back a little bit? I don't know if for everybody you cut out for a little bit, but right around when you started talking about this class, you froze for a bit for the recording.
Am I unfrozen?
Yes, you are.
No, that's great. Thank you for stopping me. So February 26th, we're starting this class with FSN and myself. I'll be teaching this class. It has a little bit of overlap with the 6-week course, but it's a little bit different. It's a 3-week class only. It will be 3 Saturdays for families who already have one child. And this is just the review as they're preparing to add another little person to their family. Since we are shaped by our experiences, we will be reviewing those. There will be a lot of partner discussion as we talk about your past deliveries, what went well, what you wish to change. These discussions will be within the couples that are there. This is not necessarily all group discussion, like big group, because some of these are personal and not everybody would like to share that. We're gonna have I'm gonna teach some exercises and some stretches and relaxation to prepare for delivery, along with reviewing the importance of hormones those last few weeks of pregnancy through delivery, because when you understand those, I feel like a lot more things make sense. We'll talk about the stages of labor. We'll really focus on reviewing coping techniques. We'll take almost the entire second class to focus on that. Since those are kind of the things that are important, but also might have been forgotten between babies. And the last week is the one that I'm very excited about and is unique to this class, because on week 3, everybody gets to come to the class. The whole family is coming. All the siblings who have been at home for the last 2 weeks because we are not providing childcare. That's a difficult thing to do at this point. I know that makes things a little bit more challenging, but they get come for this last class. And we will spend the whole time getting these kids pumped to be a big brother or a big sister. And we will talk about what they can do to help with baby. Your children are going to be your biggest helpers when you bring a little one home. I know this from bringing 3 other little ones home, and my first child is just, she adores them. She adores these babies. So we'll get them excited for their new job in the family we'll read some books, we'll do some activities, kind of like some role-playing activities, and we'll draw some pictures, things that really, depending on age, will change from family to family. But during this class, I will work with you as the parents as well to help you figure out how to get your children involved with this process. I can't guarantee that when you bring a baby home, there will not be issues, but we will talk about where a lot of the problem moments tend to be and how we can come up with a plan to reduce them. So let's go back to the goal of childbirth classes. My goal as a childbirth educator is to prepare you for this upcoming adventure. Our focus is to prepare you for that pivotal moment when a new baby is born, and then the few months that are following immediately after that. But parenthood is a journey for the rest of your life. Studies show that the satisfaction with the birth of your child not only is something that you remember for the rest of your life, but also can lead to greater confidence in your abilities as a parent. And we all, goodness knows, we who have had other children know that we have a decent amount of self-doubt when it comes to parenting, especially when it comes to raising kids. But if we could combat that by helping you have the birth that you would like, and in turn give you a healthy dose of confidence starting out, that's really a goal that I'm excited to work towards. So thanks for making time and coming and joining us today. Does anybody have any questions?
Hey, Gretchen, it's Ashley. What are the dates and times for the first course that you talked about?
The first course will be Wednesday nights, starting February 16th. Give me 1 second and let me pull up so it'll be Wednesdays from 6 to 8:30. They will be virtual, so you'll get a Zoom link. And I'm trying to all sorts of nonchalantly pull up this calendar, and I'm doing a great job of it. There it is. It's going to be through the 23rd of March. I will send this to you, Ashley, because I know you and have your contact information.
Yeah.
But I'll also give this to FSN. That way they can have it in their location as well. In the past, I've tried to share.
I'm also supposed to put the link to registration in the chat box, so that will be put in the chat box here in a second, as will an evaluation form. So in case if either of the folks who have joined us are willing to fill out a quick couple of question evaluation form, we would appreciate it, because a lot of our funders need us to do evaluations.
Oh, that's great. Can you see this calendar? Is it actually sharing?
Yes.
Yeah. Okay, great. So the blue is going to be this first class. It's going to be the 16th, 23rd, the 2nd of March, 9th, 16th, and then 23rd again. The first week we'll talk about pregnancy and relaxation. The second week we'll talk about labor and delivery. We have that breakdown just off to the side. Third week we'll talk about coping techniques for labor. That's the one that I'm always really bummed that we're not doing in person, just because that's so much nicer to be able to see, not via a screen. And I have a knee that's not great and can't show like all the squatting, whatever positions. That would be fantastic. So plus it'd be weird to show those to my camera. Even if I could, I'd do it. It wouldn't be beyond me. But fourth week we'll do intervention, interventions. So like if you need to be induced, recovery and newborn care, breastfeeding and bottle feeding will be week number 5. And then our last week, this the 6th week is community night, and just a general question and answer in case anything's left that we haven't covered. Like I said, Ashley, if you feel like dropping in to 1 or 2 or as many of those classes as you would like, you're more than welcome to. The great thing is this is a free class since the hospital's paying for it. So it doesn't matter to me how many you swing by for, especially if you've already been through this before. So I know your circumstances a little bit more than I know other people's. Sorry to share.
No, that's okay. Yeah, and somewhere in there I could give birth, so. Since my due date.
That is the goal, isn't it? Yes, and we are very excited for you. So if that's what you want to do, I support it, and I think it's really great. The goal when creating these different classes for the community was to try to reach as many people as possible, and to try to think of what I would have liked when I was pregnant. Sometimes you want the full thing. Sometimes you want all 6 weeks of education. Sometimes you want just like the shorter, more condensed version. And if there's something that's not there that you would like to do in between, I'm very happy to create something that would work out. I am teaching a 4-week class coming up really soon for a couple that nothing else was really working for them. And so we're going to have a great time for 4 weeks, and it will probably need more development that I've put that into at this point, but I'm happy to come up with something that will be accessible. Registration, I should say registration for this hospital class at this point, the hospital's still trying to pull this up on their website. So registration just includes emailing me and letting me know, hey, I'm interested in this. And so my email is listed on this. And this, if anybody wants access to this, I'm super happy to send that out as well. But like I said, it will be listed with FSN. It should be in Women's Health up here. Firstborn has it because I've been working with them. And anybody else who wants it, it's actually also on Keep It Local at this point too on Facebook. So anything else that we can think of at this point?
seems like we're in good shape. Thank you so much, Gretchen. I linked the evaluation form and the registration for the class, not the last, sorry, typo, that is happening at FSN. Do you want me to put your email in there?
You're welcome to. Yeah, that'd be great. Yeah. I check both my work email through the hospital and I check my Gmail all the time. Ultimately, what will happen is you send me an email. I'm going to lead you to a Google form to answer a couple questions or to ask you a couple questions to have you answer. And then it's a pretty easy sign up from there. So I'm hoping to see some people from the community would be great. I am really excited to be part of this community because I feel like the connections that are created are just, they're what we need to get through parenthood. It can be really tricky to feel like you are supported in your parenthood process. And so I'm hoping I can help out from a very early start with that.
Awesome. Yeah, that's literally why I have the job that I have at FSN, because I'm the chit chat coordinator. I run our chit chat playtime, which is a little time for moms and dads to come hang out and let their kids play. So that's where I built my village, and now I'm leading the show. So
well, you're doing a fantastic job. So thank you so much for letting me come.
Yes, thank you so much for coming, and thanks for all the info. I'm going to stop the recording now.